as well as other coalition initiatives that drive cancer plan implementation. The program will be collaborating with the CDPHE Built Environment team to work on reducing cancer risk factors, including physical inactivity and overweight and obesity, by connecting local organizations to funding opportunities to implement these built environment evidence-based interventions that are shown to reduce primary cancer risk, primary prevention. Finally, if you, being anyone in the audience, would like a data presentation, requires any technical assistance or provider education or other support around cancer, comprehensive cancer focus, screening, prevention, survivorship, please reach out and contact me, and we can set up a time and figure out how we can support you. Do we want to do questions now, or do we want to do colorectal and then questions?
Let's do questions for this one.
Okay.
So any questions for Ian?
While we're waiting, I'm going to put my email address in the chat.
I have one question. So for the presentations, would this be for community members, or for, we could do a presentation for maybe the hospital, or?
Yes. If the stakeholders that, I'm presuming you're asking about your region or your cancer network. If you've identified stakeholders that you want to pull into your planning and make sure that they have an understanding of what the cancer burden is in their specific county or region, we can help you with that.
Okay, thank you.
You got it.
Any other questions for Ian? All right, Ian, let's move on to colorectal.
All right. So the focus of this slide is how the colorectal cancer control program, or CRCCP, will be like supporting the coalition, and specifically the CRC task force, in implementing its action plan with a focus on links of care. And links of care is a shared care model of care where providers and systems deliver free or reduced cost colonoscopies to patients that have had a positive stool test and no means to get the required follow-up colonoscopy. This focuses on goals 5.1 and 5.2 in the cancer plan, which is increasing high quality guideline adherent cancer screening rates among average risk individuals, 5.1, and priority populations, 5.2. In the specific cancer plan initiatives that we are supporting, promoting all modes of screening, CRC screening to providers and individuals. Our motto is the best test is the one that gets done. A focus on reducing structural barriers, which can include cost, language, transportation, a lot of the things that Emily had mentioned that WWC focuses on. And then if you would like to be involved in this work, I'd encourage you to contact the CRC task force, and that is where the work happens. Thank you.
Great. Any questions for Ian on the colorectal cancer program? And you'll hear a little bit more later when we do task force updates, and we have the contact information there as well. Okay, so Ian will be on too if you think of any other questions. So now I'm going to turn it to John for the cancer registry.
Hi, everyone. As Christy said, my name is John Arend. I am the program manager for the Colorado Central Cancer Registry. I wanted to start off with kind of a high-level overview and background of what the Cancer Registry is and what we do. So the Cancer Registry is Colorado's statewide cancer surveillance program. It was founded in 1968. Our purpose is to collect, analyze, and interpret cancer data to identify trends in cancer incidence in Colorado. We are funded by state and federal funds. About 80% of our funding comes from the CDC. They have a national program of cancer registries. They fund, I believe, 49 of the 50 states in the nation. And then we also just last year were accepted as a research support registry for the National Cancer Institute SEER program. So while that has not involved any additional funding yet, we are hopeful for the future and our ability to participate in some specialized research data sets. Next slide, please, Christy. So the purpose of the Cancer Registry is to collect all pertinent data on all malignant tumors, with the exception of basal and squamous cell tumors, or I should say basal and squamous cell skin cancers, as well as in situ carcinomas of the cervix. Each report that we receive contains information on the tumor type, stage of disease at the time of diagnosis, treatment methods, and demographic information such as age, sex, race, and residence at the time of diagnosis. I will add a caveat in that treatment methods is actually first course treatment, so we don't necessarily have all of the treatment information, but at least the initial planned treatment is included on almost all reports. Next slide. So for a bit of history, as I said, the Cancer Registry was founded in 1968. We had voluntary hospital reporting, so hospitals that had cancer registries or tumor registrars within their facility reported their cases to us. By 1973, we had complete reporting for the Denver metro area. And then in 1988, with Colorado Revised Statutes 25-1-122, cancer was deemed to be a reportable disease for the state of Colorado, which meant mandatory statewide reporting. The Revised Statutes 25-1-122 authorized the Department of Public Health and Environment to basically enact rules regarding cancer reporting through the Board of Health, which are in Board of Health Regulation 6 CCR 1009-3, which we won't read in its entirety, but I do have a little snippet on the next slide. So not only does the Board of Health Regulation stipulate what we do with the data that we receive and how we collect it, but it also includes required reporting. So since cancer is a reportable disease, the healthcare entities that are required to report to us include hospitals, freestanding diagnostic and or treatment clinics, pathology laboratories, and diagnosing and or treating physicians or other healthcare practitioners. Now, I did put an asterisk on 2 of these as there are exceptions. So for hospitals, required reporting is for those hospitals that have at least 50 beds. They are required to abstract, which is the term for converting the data from the medical record into one of our Cancer Registry abstracts. They're required to do that abstracting and then submit those cases to us. And so the exception are facilities that have fewer than 50 beds. Our staff actually reach out to those facilities. We do the initial case finding, so we review their medical record disease indices for reportable cancers. And then we request access to their EMRs so that we can create those cancer reports ourselves. The other exception is for diagnosing and or treating physicians. So we know that it can be burdensome to create a cancer abstract, and for an individual that maybe they have their own practice, they may not have the time or the capability to do that. So the exceptions for those are if an individual is seen at a facility that already has required reporting. So if the physician, let's say, diagnose a patient and then that patient goes to one of our health systems across the state and receives treatment at that health system, if that health system is required to report that case, then that physician does not need to report. So an example of where a physician might be required to report is, for example, a dermatologist who reads all of their own slides. They don't send their biopsies out to pathology laboratories. They read their slides, they do all of the treatment in-house. If that individual is not seen or does not access our other reporting health systems, we would not be aware of those cancers. And so those physicians are required to report, and we are working to expand our network to enable or facilitate that reporting requirements. Cancer reports are required to be reported within 6 months of first contact. So that, for a number of facilities, they feel that that's too fast. And for most researchers, they feel that that's too slow. We do have a data lag where our data typically are considered complete about 2 years after the end of the calendar year. So, for example, right now we're in 2022. By the end of the year, we should have complete reporting for 2020 data. One of the reasons why we do provide 6 months is so that we can obtain data on that first course of treatment, so that we have more complete records when they are first reported to us. Next slide, please. So why do we collect all of this data? The purpose of collecting the data is so that we can inform health professionals and educate citizens regarding specific cancer risks, to answer public questions and concerns about cancer, to focus cancer control activities in the state. We monitor cancer incidence and trends over time. We provide our data to research studies, and we monitor the effectiveness of treatment and develop health services and screening programs for monitoring outcomes. So this is a very high-level overview of some of the data that we collect. So it is estimated that 1 in 2 men and 2 in 5 women will be diagnosed with cancer at some point in their lifetime. Currently, we have about 29,000 new cancer cases diagnosed each year. Again, these are only those that we consider reportable, so it's not including those baseline squamous cell skin cancers or in situ cervix. It also does not account for all of the borderline and benign cases. While some of them are reportable, not all are. So the overall burden of cancer across the state is actually larger than this. There are about 8,000 deaths due to cancer each year, and we estimate that there's about 310,000 cancer survivors in Colorado. Next slide. This is kind of an old slide. It's a little outdated, but I think it's still helpful to demonstrate the need of cancer registry and our cancer interventions. This is a graph of the Colorado population and cancer case projections over time. So on the left side, we have the Colorado population. And then on the bottom, represented by the vertical columns, we have the years. And so you'll see that for each year, we have the estimated total population and then the proportion of each of those populations that are either under 45 or older than 45. And then on the right side, and represented by the blue line, are the estimated number of new cancer cases annually. So what I think needs to be highlighted from this graph is that our population in Colorado is growing and growing older, which leads to quite a dramatic increase in cancer cases over time. Next slide. So now we have the top 10 most commonly diagnosed cancers in Colorado by sex. So for males, the top cancer is prostate, followed by lung, colorectal, urinary bladder, melanoma, non-Hodgkin's lymphoma, kidney, head and neck cancers, leukemia, and pancreatic cancer. And then for females, the top or the most common cancer is breast cancer, followed by lung, colorectal, uterine cancer, thyroid, melanomas, non-Hodgkin lymphoma, leukemias, pancreas, and kidney cancers. And so if you are interested in accessing any of our data, you are welcome to online. We have a robust data tool that is called COHID, stands for the Colorado Health Information Dataset. The website is at the top. It's cdphe.colorado.gov/COHID. When you access the first page, you'll see actually all of the data products that are offered by the department, or the majority of the data products that are offered by the department. You'll see cancer incidence. There's also mortality, which contains cancer mortality data. There's population data, a lot of other data, but for us, our favorite page obviously is the cancer incidence page. This is, as I said, a very robust tool. It will allow you to access data. You can search by single years or combination of years. You can get data statewide. By county, you can make a selection of numerous counties to create a region. You can get this data by sex, race, and ethnicity, or any combination of those. And then it also has trends over time, as well as a number of different sites. So it's very complete, has a lot of good information. It can be a little confusing or intimidating for those who have not accessed it before. I'm more than happy to provide any technical assistance or information on how to use it or interpret the data. You're definitely welcome to reach out to contact us at any time. And I will put both my email as well as the Cancer Registry general email into the chat. And that's it for me.
Thanks, John. Sorry for my mouse is very finicky, so it likes to go ahead. Questions for John in the registry?
Christy, we had one come in through the chat.
Oh, yes, thank you.
So, John, what's the process for people who are interested in doing research with the Colorado SEER data?
So that's actually kind of two different aspects. So as we are a SEER research support registry, we don't actually provide any of our data to the SEER program. Right now, only those core registries, of which I think there are 22 across the nation, are currently funded to provide their data to the SEER registry. So you can still access all of that SEER data through the normal channels through SEER. But our role is more evaluating data outside of the SEER registry and providing that input to SEER. If you are interested in Colorado data that's used for research, you can send an email to myself or to our general inbox, and we can work through the process of setting up a data use agreement and defining what data we will provide to you. But that's kind of an individual one-on-one process. And I don't know if there are other questions or any follow-up to that.
Other questions for the registry?
I
right,
guess one question. Sorry. So this would go based on the county they live in, not the county that they are getting treatment in?
That's correct. So all of the data is based off of their address at the time of diagnosis. So we do attempt to maintain information on current address if available, but all of the statistics are based off of their residence at the time of diagnosis. So even if, for example, someone lived in Elbert County and they come down to Denver for treatment or for diagnosis, that case will still be incorporated into Elbert County statistics.
All right, John, are you going to be on the rest of the time?
I will, yes.
Okay, great. So if anybody thinks of anything, we still have John, Emily, and Ian with us. We are going to switch over to AC, the American Cancer Society right now, and then we'll come back to the vision tool after, and or maybe a little bit later. We had some scheduling changes. So Allie, I'm going to turn it over to you now for the American Cancer Society update.
Great, thanks, Christy. Hi, everyone. I see some new faces, or new names at least. So I'm Allie Bain. I'm a senior manager on our cancer support team here at the American Cancer Society in Colorado. You may also be familiar with my colleague, Sienna Kostner or Missy Wright. And I'm actually very excited to be providing some updates around our patient programs and services today. As many of you know, COVID was very, very hard on our patient programs and services. So we haven't had a lot of good news to share for a while, and now we have a lot of really great news to share. So the first update that I will share is around our national leadership team. So we do have a new CEO, Dr. Karen Knutson, who comes to us from Sidney Kimmel Cancer Center in Philadelphia. So she was the director of their cancer center there and has been a cancer researcher for many years. So she's been with us for about a year now and has really worked to realign all of ACS to really focus on improving the lives of cancer patients and their families, which I think sometimes ACS can get a little bit segmented with a lot of our fundraising events versus our research versus our patient programs. And so she has really brought us all together to focus on that single goal that we have to really improve the lives of cancer patients and their families. And then we also have a new position on our national leadership team, which is our Chief Patient Officer. So Dr. Arif Kamal joined us about 5 months ago, I think, from Duke, where he was an oncologist with an emphasis on palliative care. And so we're already starting to see his perspective as an oncologist and his emphasis on palliative care in some of the work that we're doing. And I think we'll continue to see that, and it's really exciting. So next slide, Christy. And so for anybody that's not familiar with ACS or is not familiar with ACS as a complete organization, these are our 4 pillars. So we have advocacy, which is our ACS CAN team. So you may be familiar with RJ and Christina here in Colorado. And so our ACS CAN team focuses on policy at the state, local, and federal level, and really works to create partnerships and to engage grassroots volunteers to help to lobby and support that legislation. Next, we have our discovery arm. So ACS is known for the research that we support and the research that we do. And that includes $5 billion in research support since 1946. So no small feat there. Next, we have our patient support pillar, which is what I'll kind of be focusing on today, and which is a lot of the work that we do with you all and with the Cancer Coalition and CDPHE. And then certainly we couldn't do this without our development team. So this just kind of lists the different sorts of development and fundraising that we do to support our mission. So you can go to the next one, Christy. So one thing that, since Dr. Knutson has become CEO that she has really emphasized the importance of is patient navigation. And so we have already seen this start to roll out, and we will continue to see this roll out in a variety of ways in the coming months and years as we try to support both patient navigation internally within cancer centers, but also thinking about lay patient navigation at the community level as well. And so this is an exciting competitive grant application that we launched earlier this year, where we had the opportunity to fund, initially it was 13 grants, but a generous donor added an additional $300,000 to support another grant. And so for this competitive process, we received 180 letters of intent from cancer centers across the country. So obviously just with that, we can see that this is a huge need. And with the current funds that we have available, we were only able to fund 14. But the great news for Colorado is that one of those grantees does include the University of Colorado Cancer Center, and the project will span all of UC Health, which is very exciting. I think at some point we will probably invite them to one of these meetings to talk about the work that they're doing. But the project just started at the beginning of this month and will go through December 2024. Also, something that we have really ramped up again is our lodging and transportation support. So I'll talk about our Road to Recovery program specifically in just a second. But what we have started to implement here are actual grants for cancer centers to provide lodging and transportation to cancer patients receiving treatment. So UC Health currently has a lodging grant through September of 2022, and then Centura, UC Health, and Intermountain were all also funded for transportation. And then today, actually, our new grantees that will start in the fall will be receiving their award notices, and that just in Colorado will total $270,000. So definitely an investment that ACS is making in lodging and transportation. I will kind of put an asterisk by some of this, that it's up to the health system how they spend their money. So if anybody has questions about, are they doing gas cards or are they doing bus vouchers? That's really up to the individual health system, how they want to implement that. But certainly more to come. If you have questions about any of the big health systems in your local area, feel free to contact them. You can let me know, and we can get you connected with the right staff to see what sort of transportation and lodging assistance that they're offering. Next slide, Christy. And then our Road to Recovery program. So many of you are probably familiar with this program. So this program provides transportation for people who are receiving cancer treatment by volunteers. So we have a robust volunteer group that has agreed to participate in the program to drive cancer patients back and forth to their appointments. And so earlier this year, we completely relaunched Road to Recovery across the Front Range. And then as we continue to relaunch in different markets, we'll see that also expand to other parts of the state as well. But we do have some of these collateral materials available. We're always looking for more drivers. And so if anybody has any questions about any of that, you can let me know that too. And then similarly to what CDPHE is doing around clinic quality improvement, ACS also does some clinic quality improvement work. So currently we are working with Denver Health, National Jewish, and Sunrise on some clinic quality improvement projects around the different cancer screening sites that you can see here. And then, so those will span 2022. And so we will also be looking for clinics or health systems that are interested in participating in our 2023 cohort. So there will likely be some funding available for interested sites, but also even if funding is not available, we can still support sites on their quality improvement work throughout the year-long grant period. And I think that's what the next slide just says, Christy. So if anybody is at a clinic or health system and is interested in learning more about what clinic quality improvement looks like from the ACS standpoint, or is looking for some ACS support, let me know and we can start to talk about what participating in the 2023 cohort could look like. And that is a national cohort, which does allow you to learn and meet and talk to clinics from all over the country, which is kind of a unique opportunity. And then resources, ACS is pretty well known for having a lot of resources, which sometimes can be difficult to navigate. But these are just 2 new resources that we have available and will have available. So we have done a lot of work in the colorectal cancer screening space in partnership with the National Colorectal Cancer Roundtable to develop these messaging guidebooks for particular populations. So we have a general one focusing on Asian people, and one focusing on Latino people. And so we just launched this new messaging guidebook focusing on Black and African American people. So I'll put the links in the chat to that guidebook for anybody that's interested whenever I finish up here. And then kind of circling back to the CQI space, we do have the STEPS guide for increasing colorectal cancer screening for primary care providers that will be launching at the beginning of August. So there was kind of a teaser webinar yesterday about everything that will be included in the STEPS guide that I will also share in the chat whenever I get finished here. But this is a great resource for primary care practices that are looking to increase their colorectal cancer screening rates. And new roundtables. So I think this is my last slide. So one other exciting thing that ACS is doing in collaboration in the spirit of trying to reach President Biden's moonshot goals, ACS will be launching 2 new roundtables, the Breast Cancer Roundtable and the Cervical Cancer Roundtable. Both of those will be launching in October at the White House with President Biden. So super exciting. You may be familiar with our colorectal cancer screening roundtable. And then we also have one focused on navigation and HPV vaccination that have been widely successful. And so knowing that this was a focus, we decided to launch these 2 additional roundtables to help reach some of the moonshot goals. So that is it for me.
Great, thank you, Allie. Questions for Allie? All right, you all are a quiet group today. Just be prepared for when it gets to partner updates and the speed networking, that it's time to turn on your video and chat. There's one question. Do you have any specifics on how the Road to Recovery is going since relaunching in the Denver area?
So Jeanette, I know that it's going well so far, and we are able to support the ride requests right now as far as I have heard. But I know that we do at this point still just have a limited number of drivers. And so certainly more drivers would make it easier on the drivers that we currently have, knowing that there is an increasing number of ride requests as we get the word out more about the program resuming.
And when I send out the follow-up emails from this meeting, I'll be sure to include links from Allie in that email as well. Any other questions for the American Cancer Society and for Allie?
For the 2023 cohort, can that include clinics that don't already have cancer screening and treatment that are interested in adding cancer screening and treatment to their facility?
Yeah, definitely, Corey. I can, well, I guess my email is on the screen, but I can also put it in the chat too. Just
Thank you.
email and we can set up a time to chat.
Okay, thank you.
All right, just any final questions for any of the programs we've heard from so far? I'm gonna pop one. Can you guys now see this open on the CCPD funding opportunity? Okay, perfect. 2.5 years in, I figured out exactly how to do things on Zoom. So this was not added to the agenda because it was just announced late. And so I wanted to make sure to call out this, the Cancer, Cardiovascular, and Pulmonary Disease Grants Program funding opportunity that is out right now. It was launched on July 15th, and I believe, yeah, the deadline is September 15th. There are 3 different paths within this, and quite a few of them touch on cancer-related things from the cancer plan. There's built environment, there's some colorectal, HPV, and a new to it is lung cancer screening, a lung cancer screening scan. So be sure to check out this funding opportunity and see how it can help your program implement the cancer plan. Does any Ian or Emily or anybody want to add anything about the CCPD funding opportunity? That is a mouthful to say, sorry.
I can't recall when the applicant webinar is, but I feel like it was maybe already happened or it's this week. So if you're interested, like, check that out because that will probably give you some good information.
It was last week, Emily.
Oh,
Yeah.
it was last week. Okay.
Let's see. I wonder, I don't know if the recording's up yet. It was on July 19th. It looks like there are slides available there too. All right, so I'll be sure to include this in the information we send out. Okay, I'm gonna skip through a few slides and we'll come back to those. And now we'll go to our regional cancer network updates. And so we've been sharing updates as this progresses throughout our supplement with the NCI as well as the university. And we now have 5 regional cancer networks getting up off the ground. We have this kind of northeastern and northern region. We have Southwest Colorado, we have the San Luis Valley, we have Southeast Colorado, and we have an Eastern Colorado one. So I'm just gonna, this is who's in charge of each one. We have an advocate in Southwest Colorado. We have Corey, who's here with us today, who you'll hear from in just a minute. We have Jade from Southeast Colorado, who's also here, and I think you can meet her in the Zoom breakout rooms later. The San Luis Valley Relief Fund, they provide financial assistance through a nonprofit. So they're heading up the San Luis Valley Regional Cancer Network. And then Sanaya is the northeastern one. I don't know exactly what we're calling that one. So they're all here today. We'll have some regional networking opportunities later, so you can pop into those regional cancer networks and say hi. Ashley can't be here with us today, so I'll provide her update, but we'll still open up that room in case people from that region want to pop in and network. I'll give this update, Sarah, and then you can pipe in. So the Southwest Colorado Regional Cancer Network, they're up and going, and through their prioritization survey, they have prioritized genetics and family history with a focus on breast and colorectal cancer. And so we've been having some discussions with different groups from the university and others around genetics and family history, trying to figure out what the best plan of action is for them to move forward. And so we're currently looking at what is currently happening around genetic testing and family history collection in Southwest Colorado, and what capacity do people have. And then from that, they will identify 1 to 2 communities to do a twofold process. One piece would be clinic workflow on that family history collection piece. And then the second piece would be community education, so that they're starting to ask their family history, starting to tell their primary care physicians about it, and really just start the conversation in that community. So we're doing that scan right now, hope to do the workflow and piece in October, and then in November launch a family history pledge campaign around Thanksgiving. Like, hopefully you're seeing family, so make sure to talk about your family history and talk with your doctor about it as well. Sarah, do you have anything to add on any of the updates on the regional cancer networks?
No, not specifically as, for any of the regions. I guess just one thing to remind people of is this is a grant funded effort where each region is provided a small amount of money to get started, but our goal is to keep this being sustainable and keep it supported even after the grant is funded. So that's why we are connecting it with the coalition's partner meetings to keep everyone attuned and hopefully continue to grow the networks.
Great, thank you. I'm going to turn it over to Corey now to provide the Eastern Colorado update. So thanks for being here, Corey.
Hi, thank you. So I'm Corey. I am covering the Eastern Colorado Regional Cancer Network. We are focusing on colorectal cancer. I thought it was breast cancer, but I'm not sure. I thought it was colorectal and breast, but skin cancer was in there too. Anyways, we would like to focus on scan of colorectal cancer screenings and maybe get FIT kit out here in our region, since there isn't any, we don't really have any treatment or scanning options in this area. We want to work with the Colorado Cancer Screening Program to identify 1 to 2 communities for colorectal cancer screening clinic workflow and support community education. We have been in communication with the SunBus to be able to provide the SunBus out in our community for certain community activities. I know Kit Carson County was in communication with them, and I think Cheyenne County had them come out for a community event. But we want to focus on sun safety, nutrition and exercise, and the FIT kits in our area.
And then I had added one more bullet, which isn't showing here. Do you want to talk a little bit about exploring trying to get treatment out in?
Yes, so we would like to explore getting treatment in our area. I know that Cheyenne County they have done a lot of work in that area at the hospital in Cheyenne Wells, and they have a lot of screening equipment down there. Up here, I'm in Kit Carson County, but I think Lincoln County is the hospital in Hugo, they are exploring treatment options. They would like to set up a treatment facility. I don't know where they are in the process of that, but we do have another option in Lyman. One of the pharmacies has built a clean room. They just need staff to staff that clean room for treatment options. That's all that I'm aware of right now.
Great, thank you. Thanks, Corey. And yeah, I just want to add that we've already seen through getting these regional cancer networks off the ground, just the connections, the organic connections and collaborations happening from people just getting to meet people across their region are amazing to see. So it's really exciting to get all of these up and going. And hopefully, yes, as Sarah was saying, hopefully we can sustain these for years to come. So please continue to spread the word about these regional cancer networks. There is a page on our website. So if you live in a different part of the state and want to be connected to your regional cancer network, reach out to us and we'll get you plugged into the right network. Yeah, it's just really great to see these coming to fruition. Okay, Hannah is here now, so I'm actually going to go backwards in the agenda back to the vision tool, and we will go through that.
Hi, everyone. Very quick introduction, just ahead of time. My name is Dennis Wright. I'm a chronic disease epidemiologist on the surveillance epidemiology team at CDPHE. So my primary area is in cancer epi, which includes providing support to the Wellness Connection Program, comprehensive cancer, as well as colorectal. And I also assist with alcohol epidemiology, and I provide assistance to the Office of Public Health Planning. So going forward, I'll be the epidemiological contact for these programs, working with Ian and Emily, among others, and we'll make sure any needs you may have are routed within our team and sent out as smoothly as possible. But first, I'm pleased to be here with Hannah Peterson, my fellow chronic disease epidemiologist, and she'll tell you more about her roles and responsibilities, and then she'll guide all of us through our discussion of the current and future states of the Vision tool. So with that, I humbly yield the floor. Hannah, it's all yours.
Hi, all. I'm Hannah Peterson. I'm another chronic disease epidemiologist at the Colorado Department of Public Health and Environment. My primary programs and focus areas are diabetes and cardiovascular disease, healthy eating and active living, and then Alzheimer's disease and related dementias. So nothing to do with cancer, but I do hold on to this really big data dashboard that we've been calling Vision. I know many of you have used it before, and it's getting a really big overhaul and a really big makeover. So I'm going to start by talking about what Vision 1.0 was, talk through some of the problems that it has, and then talk through how we're going to change that in Vision 2.0. So heading into our next slide. So taking a few steps back, the purpose of Vision 1.0 was really to provide data to the programs, the CDPHE programs who pay for the data. So this allowed the groups to pull data for presentations, for grants, for decision-making, and really have access to that at their fingertips. So the initial audience here was public health practitioners, people who knew the data, who understood the metrics, who had context, sometimes better than some of the analysts, for what a lot of these metrics mean and could be used for. So one of the problems here in Vision 1.0 is that it got away from us. It was such a useful tool, had so much information that it started to be shared with members of the public, with grantees, with students. Classes started to incorporate this dashboard and information into their coursework. And so we lost the context that we assumed that most people had. So here you can see this is a page from Vision 1.0, which is still up and accessible. It is bar graphs on a page. And so there's really no context for some of these really sensitive and complex metrics. And so the issue here is that this can lead to misinterpretation, misunderstanding, blame, harm, things like that. And so these issues are what led us to partner with the anthropologists at the University of Denver. So we'll hop to our next slide. And so the first partnership was with these two classes, who really just tore apart the contents of this dashboard, and they proposed some guiding principles. The first and main guiding principle is, whose perspectives do we want to center? And this comes from the recognition that myself as a white woman has never not been centered in data, and my story has never not been told. But this is not true of many communities and various people groups. And so the way that we recenter perspectives is to provide more context and to use more data. And I use that in quotes to sort of get us to become more comfortable with the use of both quantitative data and qualitative data. And the methods for providing perspectives are the use of images and videos, language, and that can be in the form of like interpretation or discussing the complex relationship between these structural inequities, these institutions, and some of these health outcomes. Another method is the use of resources, recognizing in a data dashboard that real estate is limited. And so there's a lot of really good information and resources out there that can be used instead of recreating wheels. And then the last piece for recentering perspective is to include feedback. Most of this data would not exist without the partnership of members of the community, so it only seems fair and right to have those individuals who are represented provide feedback on how they are being represented. And so then the method of pulling all of these techniques into providing context is one of curation style. So thinking of, entering a museum gallery, it is curated to set a feel, set a tone. And so that's sort of what we're attempting to do with this next version of the dashboard. So next slide. So now that we have the layout or sort of the theme of where we're going, the structure of Vision 2.0 will be one of topic specific pages. So it's easier to provide context and to content that is isolated. And so if you look at that, going back to that very first slide with all the data on the page, you can combine and add, and you can look at weight status and nutrition metrics and cancer screening metrics all at once, but you really lose context and don't have the ability to provide information about each one of those metrics at a time. So topic specific pages is our format moving forward. And so we took this idea of the techniques, and we went to the programs and we said, here are the list of metrics, data metrics that we plan to present onto your page. Go, therefore, and find images and write text and find resources that help supplement and contextualize the data metrics that we're sharing. And so for the cancer programs, we came up with 3 large buckets of data metrics, and those are cancer prevention, screening and diagnosis, and survivorship. So once we had the buckets, the metrics, and then the information from our programs, we went and created this template. On our next slide, perfect. And this really incorporated all of those pieces that we learned from our first partnership with the anthropologists, that we need context and additional things like that. So you can see sort of the wrapper is really small, but we've started to add language. And so this wrapper here says, to achieve better cancer outcomes, we must work together to remove barriers to ensure that each of us can get screened on time. We have an image, we are all familiar, I should say you are all familiar with cancer screening guidelines and probably recite them in your sleep. But members of the public probably don't know exactly what each of these guidelines are. So, now we're looking at, Data metrics of colorectal cancer screening meets guidelines. What are those guidelines? Well, they're in the picture. So starting to add additional information to this quantitative data that's presented here. So our next step was to take this template and send it through some community feedback forums. And so our next partnership with the anthropologists was to do just that. And so our anthropologists partnered with one of their courses, and they interviewed about 56 individuals, asking them questions about representation, about interpretation. Do they understand what they're reading? Are things tied together? Do they see themselves? Do they see somebody they know? Is their community represented appropriately? Questions like that. So currently, we are taking all of that information from all of those interviews and attempting to update the page that we just looked at that incorporates all of that feedback. So that's the part of vision that people see. Now, the part that people don't see is the technology side. And so historically, vision has been created using the Tableau suite. But the challenge there is that there's a lot of data that has to go into this dashboard. And so somebody, me, has to anticipate all of the crosstabs that people would want to look at. Cancer by age, cancer by gender, cancer by racial ethnic group, cancer by education, and then do that for all 60 metrics. And so it becomes really cumbersome and complicated. And so something that we're attempting to do for Vision 2.0 is to create an interactive platform where users can select inputs and outputs, and then auto calculation magic happens in the background. So it's really going to be a really useful tool. No longer are you subjected to the basic 2x2 tables that I prescribe to you, but will really allow a lot of freedom and flexibility in how people use this tool. So we've been told that you can use R, the statistical coding software, and Tableau together. It doesn't really work. So now we've navigated on to creating an R Shiny dashboard, which is where we are right now. So two big pieces that come together to make Vision 2.0. And assuming no other hurdles, the anticipated rollout of both of these pieces will be in the fall of 2022. I do want to stress that in the meantime, all of the data is still available. So if there's something on Vision 2.0 or Vision 1.0 that you need updated, please don't hesitate to reach out to Dennis, and we can work on getting that data for you. So thank you for having me, and I'm happy to field any questions or yield any time.
Thank you, Hannah and Dennis. Questions about vision? Okay. Well, Hannah, are you going to stick around for a while, or are you popping off?
No, I'll be here. You can put things in the chat. I'm happy to respond there.
Perfect. Thank you.
Thank you.
All right, I'm gonna jump back forward. Okay, so now I'm gonna share a few updates from the coalition and things that we've been up to. So we just launched a chat bot on the coalition's website. So if you go to any page, it's in the bottom right-hand corner, you can chat with the chat bot. And the use case we're exploring right now to use for this is like a patient navigator extender, since we know there's not enough patient navigators out there. So how can we automate some things to get people to the right resources? And so the first phase of it has cancer screening information for all the different screenable cancers. It has family history messaging to get people to start exploring their family history of cancer. It also takes, we have an Excel spreadsheet of support groups, and it takes that information and puts it into the chatbot as well. And we just added some financial resources so that people can find the financial assistance resources too. The next phase of it we'll be adding all of the resources from the cancer map will be also on the chat bot. And so you can search by, not technically by zip code, you'll be able to search by like a grouping of zip codes to find those cancer specific resources near you. And another phase of it will also, if there's a clinic that wants to put the chat bot on their website and actually have people, you can add, we'll be able to do that. We can basically duplicate the chat bot and put it on your site. And then we can even add workflow questions about how people can schedule their cancer screenings so that we can really close the loop and get people scheduled for cancer screenings. So play around with the chatbot, share the chatbot. If you find errors, please let me know and we'll get those fixed as soon as possible. And if you work in a clinic that would like to use the chatbot, definitely reach out to me too. We're not quite ready to duplicate it, but we're very soon we'll be ready to duplicate it and put it on clinic websites so that you can start having a dialogue with your constituents all around cancer screening, cancer prevention, and family history, and help them find the resources that they need right when they need them. Any questions on the chat bot? Okay, the next update, it is coming very rapidly. We are planning a huge cancer spectacle out in Pueblo, the first weekend of the Colorado State Fair. We will have AstraZeneca's inflatable lung with a virtual reality experience, an inflatable colon. 9Health will be giving out fit kits and/or having them available for purchase depending on need. The Sun Bus will be there with some dermatologists on board. Prostate Conditions Education Council will be there doing blood, like PSA testing and informed decision making. And then we have a lot of different other partners. Centura will be there trying to capture people's information that live close to any of the Centura hospitals and get them in for their cancer screenings. We'll have some lung medical professional volunteers to try to help people go through the eligibility for lung cancer screening and get them scheduled for low dose CT if they're eligible. So we're trying to make it as interactive and as impactful as possible. So as people walk through, we're going to try to capture their information and follow up later with what screenings that they are due for, so we can really help try to get them in and really help move the needle on some of these cancer screening rates. There are a lot of opportunities to volunteer if you wanted to drive down for a 3-hour or a 6-hour shift, or you're planning to come to the fair and want to work a little bit while you're there. There's a lot of volunteer opportunities for different organizations. Komen will also be there. The university will be there. The White Ribbon Project will be there. So it is really just going to be a truly huge cancer spectacle. So we'll see how it goes this year and see if partners want to do this again next year. A few other updates. I talked last time about restructuring from our steering committee to a board of directors. And so I am actively recruiting board members right now. You can at any time also join a task force for anything that you're interested in. We have the regional cancer networks, and we are looking again at doing the symposium. And so I'm going to pop a quick poll question in. Would you attend an in-person symposium this year on November 3rd and 4th? Let us know if you would attend in person or if you'd prefer virtual. Okay, I'm going to let a few more people vote. Okay, so it looks like a majority would attend in person. Some would definitely prefer virtual. So all right, well, We are going to get to finalizing that. So stay tuned to save the dates and things like that. But tentatively plan right now for November 3rd and 4th for our first in-person symposium since COVID started. I just want to talk a little bit more about the board members. So historically, we've had a lot of expertise coming from cancer professionals. And so along with that expertise, we are looking for fundraising, policy, communications and marketing, law, and accounting and finance. So if you know of anybody who fits this skill set and is looking for a board position, please spread the word. We're trying to grow the board just to take us to the next level. So those opportunities are there. And then I'm going to pop in one more poll question before we get started. This is about task force involvement of, have you ever participated in a coalition task force? And there's 2 questions. I'll give it one more minute, one more second. Okay, so it looks about 59% have participated in a task force before, and about 50% are participating now. So we're about to jump into the part where we hear from task forces. So hopefully you'll hear something that piques your interest and want to engage in a task force going forward. All right, so first up we have clinical trials and treatment. So I'm going to turn it to Daniel.
Hi, so we are in the process of starting back up this group. So it's going to be run by Lisa Schweitzer, Jessica McDermott, and myself. And if you're interested in joining, let us know. But right now we're working on making sure that there's going to be representation from every single organization in the state that is providing oncology care. So that way it'll be a diverse both by organization and geographically. And then we're also working on making sure that there's going to be as many sponsors or pharmaceutical companies there as possible. We had a large turnout at our last one, and we're hoping for the next one. And the date will be coming very soon. We're actually meeting about it tomorrow morning at 9. So more to come, and email me if you have any questions. Anything else, Christy?
Nope, I think that's it. Thank you.
All right, thanks.
All right, Ian and Sarah.
Hello, everybody. I'm Sarah Roberts. I work with the University of Colorado Cancer Center, and I'm the co-chair of the Colorectal Cancer Task Force. We are working on finalizing and implementing our action plan. So as Ian mentioned earlier, we have a couple of work groups within the task force. One is a Reducing Barriers work group, which addresses goal 5 of the cancer plan. And right now that work group is working on determining their priority region and working on identifying community organizations to partner with. And collaborating on links of care, which Ian described earlier. And then the second work group is the awareness or promotion of colorectal cancer screening awareness work group. And we are supporting a fundraiser to purchase fit kits with for a clinic with limited resources for screening. And from what I understand, those fit kits have been purchased, and we are trying to help guide how those will be implemented and where best to disseminate those or distribute those fit kits. And this work group, the awareness work group, will also be providing one-on-one education at community events as well. So if anyone knows specifically of a clinic or a community organization that would want to benefit from the support of the task force as a whole, or even reducing barriers to screening or awareness, let us know, and we can we can touch base there. We've had a few, we've had 4 already, food access and built environment webinars. So it's been a series in collaboration with the Survivorship and Palliative Care Task Force, which was focused on goal 2 of the cancer plan. So increasing prevalence of health behaviors and tying that to prevention and survivorship. A lot of really interesting material was presented and discussed, and those webinar recordings are found on the webpage. Our last one was actually just last week.
Yep, and all 4 recordings are now there. I was able to hop on for the last one. We had the mayor of Paonia presenting on that one. So definitely pop into those recordings and see what some rural and urban counties are up to as it pertains to built environment.
Yeah, thank you. And if you would like to join the task force, so we've mentioned the work groups, but a lot of discussion can happen just during our task force meetings. So the work groups are something that is done outside of our monthly meeting. And we try to, basically it's a choose your own adventure kind of task force. If you want to have the monthly meetings be where you spend most of your time contributing to that task force, you can join us on the 2nd Thursday of every month at 7:30 in the morning. We're meeting virtually right now. You can contact Ian or I to join. And also, yeah, it's a great way to connect and continue to get partner updates and connect with other community members doing work in the same area. So let us know if you'd like to join.
All right, thanks Sarah and Ian. Next up we have the HPV task force. So Ashley, do you want to give your update?
Yep. So we're just working on implementing our action plan as well and trying to address the cancer plan goal 3 and 5. So just aligning to increase focus on rural and frontier communities and increasing cancer prevention, HPV related cancer prevention. We also wanted to highlight our arts and wellness event that we're helping collaborate on. We're providing $3,000 of our budget to support this event, where they'll be offering free PAP tests. So our task force meets the first Thursday of every month. So you can email Jenny or I if you would like to join. I can put our emails in the chat.
Thank you, Ashley. All right, I'm going to be providing the Latino Task Force update. They're all out of the office this week. So they have hit the ground running. They have, through their budget, they have funded some colorectal fit kits. They've worked at a few different 9 health fairs doing, providing education and barrier reduction at those health fairs to try to educate people around cancer prevention. They've hosted some educational talks on different cancer topics, focused on translation of some materials. They've been working, they found a social media outlet that would be great to get information out to. So they've been working on getting some social media awareness out there. And they've also been trying to find navigators that speak Spanish and can help connect people to resources in Spanish. That for going forward, they're looking at hosting monthly educational discussions. They're looking at how they can partner with 9 Health for the fall fair season. They have a few media interviews lined up as well. They're looking into the MammoCare training, which is a way to train people on doing breast exams. And they're looking at starting a new monthly support group. Their email is latino@coloradocancercoalition.org. So if you want to join that group, you can email that email address and get added to their task force. Debbie, you're up next for lung.
Sure. So it's a exciting time for us. in looking at the Lung Cancer Task Force. We have a lot of projects on the horizon. We are certainly planning to participate in the cancer spectacle. This photo here, oh, do you want to show that photo? So this was a recent event we did at Heidi and Pierre Anda's house. It was a white ribbon build. And we built a number, I think over 200 of these ribbons. And we do plan to use them in November as part of Lung Cancer Awareness Month. It was a very successful event. It was a hot day. We were all very busy outside making the ribbons. Our task force has been also collaborating with the CCSP program. We're trying to take a new tactic this year. Instead of doing a webinar and having folks come to us, if you would, or if you will, the idea is that we want to go out and go into communities that don't have active lung cancer screening programs and try to support them in developing programs. So we're looking at trying to target 2 rural areas in Colorado. We've already made a connection with the Keefe Memorial Hospital in eastern Colorado. And we are hoping that we can sort of do a road show, if you will. So we'll see where that goes. We haven't tried this before, so it will be interesting. We have really, we've expanded the membership of our task force, and I think we've tried to embrace folks that have interest beyond screening. So part of our, obviously with the ribbon build, is just to increase lung cancer awareness and look at what we can be doing to help support survivors. Also, there's a lot of excitement going on in the lung cancer world with new treatments and targeted therapies. So we just have a lot of work to do. We know in particular the uptake of lung cancer screening is low in Colorado. Nationally, it's somewhere between 5 and 12%. In Colorado, we're at about 3.3% uptake. So we really have to engage the folks out in other areas. We know that a lot of lung cancer screening that is going on is in the Metro Denver, Colorado Springs, and Fort Collins areas. So we really have to try to reach some other folks. So we would like to build a stronger partnership with the Tobacco Control Group at CDPHE. And so we think there's opportunities there. And let's see, what else? That's all I can think of at the moment. But we'd love to have other members join our task force if you are interested. And again, we're not just focusing on screening, we're trying to really build more survivors and help just in the overall lung cancer awareness and support.
Thank you, Debbie.
Our next meeting's August 16th.
Great. And I've been trying to be better about coalition emails having all the task force meetings. So you should be able to find task force meetings from any coalition emails that come out now. All right, the next up is the navigation task force. I don't think Emily or Rachel are here. So I can give a brief update from theirs. They meet the third Monday from 10 to 11. They are working on getting their Navigator Night Outs up and going. They've hosted one, and so I know they're planning out the agenda for the rest of those Navigator Night Outs. And they're also looking at topics that go across task forces. So be on the lookout for emails from the Navigation Task Force about educational opportunities that don't necessarily need to be geared towards the navigation audience, but might touch on your task force's topic. And they're helping with the chatbot, with reviewing and adding resources to that. And they're also just really looking into how can they create a referral process between navigators so that as they find patients that need something, they know exactly who to go to in different parts of the state. So that's what they're up to right now. Then next up, we have the Skin Cancer Task Force. They're working on diversifying their membership of the task force, looking at trying to provide 2 different educational opportunities, and then also just looking at ways to work more with the Sun Bus and get out into the community. We've taken the Reveal camera out to a few events this summer, and it's just always fascinating when people see that the sun damage on their face, that you can almost instantly see their brain like, oh, I really need to change my sun safe practices. Let's see. I just want to mention too, some of you might know Deborah Hess. She lives out in Grand Junction. She's been busy out in the community, taking the Reveal camera, giving sunscreen at different outdoor events in Grand Junction. So a big thank you to her for doing that on her volunteer time. And Deborah Hess again also was at the VA a few months ago and did a few videos on skin cancer education, as well as how the UV Reveal camera works. And so there's 4 new videos up on our website that you can check out all around skin cancer and sun safety. And their next meeting is August 5th. Okay, do we still have, okay, Carlin, do you want to give the Survivorship Task Force update?
Hi, this is Carlin. Can you hear me?
Yes.
Okay, forgive my lack of camera today. We are a task force that is about 200 members strong, and we are always welcoming additional people who would like to receive timely updates about events going on in Colorado and nationwide. We are working on 2 big goals from the cancer plan, which include increasing mental health awareness and interventions, and then increasing palliative care knowledge and interventions. We definitely appreciate partnering with different people and organizations as we go forward to bring this to fruition. Next slide, please. I would like to take a moment and thank the Colorectal Task Force for partnering with our Built Environment series. That webinar series was fantastic. So we're probably going to do something mental health wise for our next webinar series, and more information will be forthcoming. We hope that you enjoy the last few days, weeks of summer, and we look forward to seeing you on the 7th of September at 12. And if you're interested, again, in receiving updates or getting involved, our email address is here. Thank you.
Thank you, Carlin. Okay, I'm going to speed through these so we can get to the partner updates and the networking. I've already mentioned the Cancer Spectacle. There's a page of it up on the website, and lots of volunteer opportunities. Join any task force. I'm also happy if you don't know where the best place for you is on the coalition, please feel free to reach out to me and we can set up a time to chat. We've been hosting the monthly Cancer Partners peer sharing on the 3rd Wednesday of the month. And then I have the information on the symposium down here. What else? Okay, that's it. I want to get to this so you all can have a chance to share your updates. So please feel free to come off of mute right now and share any updates that you have, programmatic updates, funding opportunities, events. Now's your time to share that with the broader coalition, and then we'll pop into networking after.
Hi, I'm Monica Myers. I am new to Colorado, and I am the Director of Oncology Services at Gunnison Valley Health. I have 39 years of oncology experience in any type of oncology environment you can name. And I really look forward to becoming an active member of the coalition and getting to know my neighbors around here and then on the Front Range, because we get a lot of referrals from the Front Range. So it'll be just great to get to know you all. Nice to meet you.
Awesome. We're so glad to have you here. Thank you for joining today.
I'm Daniel Pacheco. I'm with the Colorado Cancer, or University of Colorado Cancer Center, Office of Community Outreach and Engagement is our full name. So we're just still busy with a lot of our community projects. I guess one of the major updates is we're partnering with 9 health fairs this coming year to do some education at their health fairs, and then also some colorectal cancer screening with some other partners as well. So that's kind of a major update. But other than that, we're just trucking along. Thanks.
Thanks, Daniel. Who's next? Go ahead, Arn.
Hi, everyone. I'm Arn Manconi. I'm the Executive Director of Live by Living. I just want to make an announcement that we still have quite a few openings for our retreats at the 10th Mountain Division Huts this summer. You could go to our website at livebyliving.org, and I'll put it in the chat. So if you know of any survivors who'd like to get outside, and it's all expense paid, free trip. And also we're sending out our brochures to all of the cancer treatment centers. We're having difficulty getting referrals of survivors into our programs. So if anyone has ways of us getting out to more survivors, I'd appreciate your assistance. Thank you.
Thank you, Arn. And I'll just add the coalition and the survivorship task force and Live by Living have had a conversation on physical activity and even in mental health for cancer survivors. And so we are working together to try to figure out how we can get walking support groups going at various different treatment locations. So stay tuned for more info as that comes to fruition and we finalize what that process looks like. Tara, I see you off mute. You want to go?
Yes, my name is Tara Galliano, and I run Boulder Sex Therapy, and it's a pleasure to be following after Live by Living because I was a volunteer with them for a number of years. And what I offer now is I offer a support group for women with cancer, primarily focusing on sex and sexuality. So a new group is starting in September. It's called Cancer, Sex, and Women. And there are multiple dates and times available for the groups, and they are intimate groups in that they're going to cap out at 6 women. So I wanted to let you know about this if you know of a woman who's interested in a process group specifically around sexuality, cancer, and functioning after cancer or with a cancer diagnosis. Oh, and my website is bouldersextherapy.com.
Thank you.
You're welcome.
All right, any other updates? Okay, I want to make sure we can at least pop into the breakout rooms at one time. So, oops, before we do that, let me just put in our link to the evaluation just in case people head out. Please do take a minute to fill this evaluation in when you're done so that we can make sure that we're looking at that feedback and incorporating it into future partner meetings. So that's in there now. So now we're going to do some networking. If you are on the Spanish channel, make sure you stay in the main room. And if you want to speak to somebody in the main room, you can stay in the main room and simultaneous interpretation will still happen there. as I said earlier, we'll open up all the regional rooms. They may or may not have the regional lead in them. So if you get into a room and nobody ends up joining you in that room, feel free to come back and then hop into another room. I have it set up so that you can move in between rooms. And if you live in the metro area and want to pop into some other region, feel free to pop into that region. So I'm going to open them all up now and let you all in. Well, I'll just let you guys in. We'll see if we want to come back. But so go have fun in the Zoom rooms, and just thank you all for being here today. And I'll bring you all back, but go hop into the Zoom rooms for now. And you have to pick which room you want to go into. It will not automatically pop you into a room.